Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is July the 14th of 2021 and we're up and running. I'm by myself here today, but we still keep our promise to see patients if they need us. Just have to work around the schedule a little bit, so give us a call if you feel bad. So I'm gonna give you a little pearl this morning and talk about it. Urinary tract infections. Okay, I see these almost daily. Okay, they're very common. And unfortunately, they're more common in women than I think men, but they're probably 75% of them are usually women with maybe 25% men. So let's talk about a urinary tract infection. And urinary tract infection is when you get a bacterial seeding of your bladder or your lower urinary tract area. And it's typically characterized by funny or foul smelling urine or cloudy urine. It can be irritation when you urinate, like a burning or a stinging, or it can be a little bit higher than that, and there'll be a irritation of your bladder, which can cause bladder spasms and things like that, and it hurts. And now I'll be honest with you, if a woman comes in here and tells me she's got a UTI, she's probably right. The burden I have to do is I have to look at your urine and make sure they were right, because it can just be bladder spasms. Bladder spasms sometimes will be just like a urinary tract infection, but there will be no bacteria there. There'll just be a spasm, and of course that's treated different. The complicated thing is that sometimes when you have a urinary tract infection, it causes bladder spasms. So I'll treat the urinary tract infection and the bladder spasms will decrease. Sometimes it's only bladder spasms, and those can happen spontaneously, and we don't know why or anything like that. So typically, if you're having these symptoms and you'll need to be treated with an antibiotic, I have regimens. I try to give people the least amount of antibiotics to accomplish what we want to. And we typically will use ciprofloxacin or macrodatin or macrobid. And then sometimes these medicines won't work with people, and then we have to check a culture. Like we send it off to the lab and get the organism that's given us the problem identified, and then it gives us a sensitivity, so we have to cater our antibiotic therapy based on what the sensitivity of the culture is. So that's how we handle them. Some preventive measures you can do for that are, first of all, drink plenty of fluids. That's one preventive thing. There is an herbal medicine that sometimes people use, and I've heard some really good results. It's called D-mannose. We don't sell it here, but I do think it is sold at some of the health food stores around here, or you can get it online. It's called D-mannose, D-M-A-N-N-O-S-E. I've had several patients tell me that works really good for them, so that's a good way to prevent it. The other ways, some of your hygiene in that area, and you can ask me what those are when you come in. I don't want to talk about it on video, but anyway, there's other strategies we can use, and I usually go over them with folks when I see somebody with a UTI. Okay, a lot of times they're unpreventable, particularly in men. I think men's are not that preventable. Okay, but if they have recurrent infections, or we keep having problems like this and I can't get them under control, sometimes I will refer you to urology and let them take a closer look and see what's going on down there and make sure there's not something we're missing when it comes to your urine and your urinary bladder. So that's a little bit of education on urinary tract infections. Now the key here, I want to bring up one more key point. If you think you're getting a urinary tract infection, or you feel like you've had one for several days, you really do need to seek medical care, okay? And it's particularly if you're getting worse, or you feel like you're getting sicker, like with a fever, chills, or dizziness, or extreme uncomfortableness, because sometimes these things can go on and get in your bloodstream, and they can cause a lot of problems, or they track up to your kidneys and they cause lots of problems. Okay, so let's, if you think you got a urinary tract infection, certainly don't sit on it. Some of the pharmacies around here will sell Azor or Azo, the numbing medicine for urinary tract infections. I want you to use that with caution, okay? Because if you've got an infection down there and it's irritating your bladder, I don't want us to numb it okay, because that can kind of set you up for it to go other places. So be mindful of that. If you think you got a UTI, start drinking water and start trying to get a hold of us. And if it's a day we're not working, you can go to an urgent care or something like that, okay? But definitely get to us before it gets really bad. All right, as far as COVID, there's 1,598 cases. I'm disappointed. That's 3 up. I'm really hoping this thing just stays out of our community. But we're going to keep an eye on it. And I know there's a lot of talk going around about the variants. I'm just going to keep my eye on what's going on, and I'm going to keep my eye on what's going on around here. And we will be there trying to mediate all of these complications if they come along with the variant and things like that. We'll help you. Okay? All right. I'll mention Place of Hope again today. It's a nonprofit that I'm a trustee in, and we try to have a positive impact on the people in the community, the children that get put in foster care, and we try to make it less traumatic than it already is. If you've got any more information, or if you want to hear more about that, just ask me. I'm pretty good about talking to people about that. I'm pretty inspired by it. So just let me know. Otherwise, you have a great day. It looks like it's going to be beautiful weather all day. And enjoy yourself. And call us if you need us, okay? Thank you.